Hi everyone, welcome back to my channel. I'm Laura, I'm a dermatology PA. I love being a PA, it's why I started this channel, to share that with you. So today I'm actually going to be interviewing someone who was my preceptor while I was in PA school, Diana Afonso. She's an amazing emergency medicine PA, and she agreed to sit down with me over Zoom and let me ask her a few questions. So we'll have those coming up. If you have any questions or any suggestions about other PA professions you'd like to know more about, let me know in the comments below. And I hope you guys enjoy this video and learn a lot from it. And I'll see you guys there. Bye. I'm gonna start. Okay, perfect. So, all right. So thank you so much for doing this. First of all, I'm just gonna dive right in. We met when I was in PA school. You were like a preceptor for us, and also a visiting lecturer and assistant professor, right?
Right.
Okay.
Adjunct professor.
Adjunct professor, that's right. And you did like our ER module, and I loved working with you in the emergency room. So I would like just love to hear about what it's like to work as a PA in the emergency room. Just tell us about that.
So it's been interesting. Going to my 11th year, believe it or not. I started very young as a PA. Just kidding. So going to my 11th year, I never ever pictured myself working in emergency medicine when I started as a student. Was always obsessed with pediatrics. And then, like I tell everyone, things change. You go on your rotations, you become more open-minded and exposed to different scenarios, and you decide, wow, I like fast pace. I like being able to, constantly be challenged. I like working with the underprivileged communities, patients that don't have insurance. And I also like the ability that I speak Spanish and Portuguese. I can kind of use basically all my skills. And so I liked working fast paced. I liked doing hands-on. A lot of what we do is procedural, but it's also like we're in the middle of everything. So I always feel like I'm challenged. I always feel like I'm up to date with all new medical advances, whether it's imaging, whether it's diagnostic, whether it's, new medications, what to use, what not to use. Teaching and working in at Brown Emergency Medicine, it's a teaching facility. It's also been very helpful. So past 11 years have been crazy. ER is always busy. It's always, fast paced. You never know what to expect. You'll never see the same thing in 2 days. Just when you think you've seen it all, something else comes. And then the pandemic hit, and obviously the ER and emergency department and the ICUs got hit pretty hard. From not knowing, how to diagnose, what to treat, having the proper equipment, to now feeling actually stable and knowing what to do was quite a difference within the past year. I think we've come a long way. But emergency medicine continues to have my heart. It continues to be the place where I feel comfortable, and probably still practice the next couple of years, as crazy as that sounds.
Yeah, I mean, if working in emergency medicine during a pandemic and you're still liking it, then I think that means that you're in it for the long haul, or you're really passionate about it. So that's
Yeah.
Okay. So yeah, I definitely, like, during my rotation, I saw that side of it for like the 5 weeks that I was there. It was just so dynamic, so constantly changing, always on your feet, always thinking, always like doing procedures. What is your like day to day like? Let's say like a typical week for you, schedule wise, cases wise. Like, what would that look like for you?
So that's the one downfall of emergency medicine. Your schedule changes daily. So you kind of get your schedule for the month. You work a certain amount of hours per month. So normally it's about 156 hours per month, and those can be divided in different shifts, whether it's a 12-hour shift, a 9-hour shift, a 10-hour shift, days, evening, nights, all different pods. There is a plus to it. So you can go on mini vacations a lot. You can kind of divvy up your days, where you can have Tuesday and Wednesday off, and you can arrange it to fit your liking or your family's, style, but it changes every day. So yesterday, for example, I worked till 1 a.m. and then I'm going in shortly for another shift. I'll be working till midnight. Again, tomorrow I'll be working 3 to midnight. Then I have off a couple days. I'm back on Monday in the morning. So it changes every day. Also, it changes in my emergency department. We have pods, so we'll have critical care, we'll have fast track, we'll have patients that require telemetry. So every day is different. But we kind of just work, I'll get my schedule for the month, and then I'll figure out when I'm working, and then I kind of divvy up life. It's fast paced. I feel like I'm lucky in emergency medicine because I'm never bored. Or I always say if I worked outpatient medicine, I'd be spinning, I'd be seeing those patients so fast. But there is, pros and cons to everything. And that's why we're very lucky to be PAs, because at any point we can change some specialties. So there's a nice mix to our profession.
Yeah, that is really nice. There's definitely a foot for every shoe in this.
Absolutely.
Okay. So you kind of see like everything as far as emergency medicine. It's not like you're only like doing like cardiac or anything like that. Like
Nope.
you're literally seeing everything.
Nope. Yeah. So from the beginning, I would have pods where I was working critical care to fast track. So I work with Rhode Island and Miriam. We also have the opportunity to work at Newport, but I do Rhode Island Hospital and Miriam Hospital. So Rhode Island is a big trauma 1 unit, the only one in Southern New England. So we have all different traumas down to, cardiac patients, stroke patients, fast track patients. And then we have the Miriam Hospital, which is a community hospital where you see everyone kind of in the same pod. So you could be dealing with a toe injury, and then you can be dealing with, an acute stroke or heart attack, all those different things. So you can see it all.
Yeah.
And PAs, honestly, I always say you can do as little or as much as you want. And we do work in every subspecialty. It's not like we just work in the fast track area. We're working in the urgent areas too. And you have shifts where you're only dealing with low acuity things. And you have days where all of your patients are really, really ill, especially recently with the past pandemic and patients delaying surgery and delaying medical care and not seeing their PCPs and having a lot of practices closed. What we're seeing right now is, high numbers of patients that are extremely ill, unfortunately. So we're trying to just catch up for the past year.
Okay. And then can you walk us through what a shift would look like from you, like arriving in the emergency medicine department, let's say you're doing, like, for example, a shift like today, like 3:30 to 8. What would that look like?
I'm going to go in and we're going to round. So there's going to be a team that I'm going to take over the patients and then start picking up new patients. So we round immediately when I get in. I kind of go in, I sign in. I'll see if there's any new patients to pick up. I'll immediately pick them up. We'll round, and then I'll start off by seeing new patients, and then I kind of catch up with the other patients. And then you keep going all day. One thing about emergency medicine, we don't take breaks. It's kind of like a taboo. We really don't. We'll eat or drink literally within 1 or 2 minutes. We don't take breaks, and that's just the way we are. We really don't have time to take breaks, unfortunately. It's just part of our culture.
Yeah. Oh my God, I remember that. But in a way, like, I know that sounds like so bad, but in a way you almost forget to take, like, you don't even think about it. Like, at least that's how I felt when I was there, like during my shifts. I just didn't even think about it. And then I'd be like, oh my God, I've been on my feet for like 8-10 hours and I'm starving.
Yeah, the shifts go by so fast that you don't realize, and it becomes part of just your routine.
Yeah.
Just the choreography. Like I always say, I'm a dancer. The choreography of dance, the choreography of emergency medicine. You just go, go, go. Yeah. And then you don't even realize it. So it's not made for everyone. It's for someone who has to think fast, act fast, and like that fast pace. I'm someone who likes the fast pace, and also to be challenged, constantly thinking like, why is this person coming in? What is their emergency? Yeah. Let me make sure I'm not missing any life-threatening illness before, I send them home. So it's challenging, but it's definitely,
for sure. Do you have like a favorite procedure that you like to do, or a favorite complaint that you like to evaluate? Like, is there something that when you see it pop up in like the sign-ins, you're like, oh, I wanna go do that one?
I mean, I don't really not really a favorite chief complaint. I will say I always like abdominal pain. I did always like gastroenterology and also like women's health. And for me, when you deal with any kind of like abdominal complaint, typically you can kind of find an answer. You can get the blood work, the imaging, you can feel reassured, where there's a lot of other diagnoses or chief complaints like dizziness, chest pain, things that can continue to evolve even when you're seeing them within that window. So belly pain, I like, procedural, kind of like them all. We do a lot of lumbar punctures, INDs, and lacerations are bread and butter every shift, even down to paracentesis, a little mix of everything. So we're very lucky. Even, knee aspirations, reductions of the shoulder, toe reductions I had to do one yesterday, splinting,
Yeah.
all the fun stuff.
It's so cool. Even like last time when we tried to do this, you were like, I'm sorry, I'm still in the ER doing a lumbar puncture. Like, get away. And it's like, oh my God, they're like, yeah, you
Yes, I remember that last minute. I had
yeah.
a patient, and of course, no deed goes, what do they say? Unpunished. You know that saying, I probably messed it up, but just tried to see a patient really quick to help with the flow. And of course, it was a patient that needed a lumbar puncture. It's always like that.
Yeah.
So, yep, you never know.
Yeah. Okay. All right. Cool. So, so we talked about your like what a typical week would look like, schedule wise, what a typical day would look like. We talked about like pros and cons of working in emergency medicine. What would you say as advice to someone who's interested in emergency medicine and they're either about to go into PA school or they're in PA school? Is there anything that
Yeah, for sure. So again, for those students or those interested in working emergency medicine, again, never have fear, because when I first started off, I was obsessed with pediatrics. Started volunteering at Hasbro Children's Hospital since I was in high school. Did childhood asthma research. Always did everything pediatric wise, and I still love pediatrics. But then after going to school, I realized I like general medicine too. I like the fact that if anyone needed me at some point, I could help them anywhere I am in the world. If anybody kind of had a generalized question, I could actually help them and have some kind of knowledge. That's what led me toward emergency medicine. I would say any kind of exposure early in. So becoming an EMT, becoming a tech, becoming a scribe, really having exposure to working and just being in the setting where you're used to the chaos, you're used to the noise, you're used to seeing all different presentations, and then you're prepared for it. And then you really know, do you have that in you? Because like I always tell everyone, you're either made for it or you're not. And that's the best way to kind of know.
100%. I totally get that. And honestly, that's a big reason why I even want to do these videos, because it's just like, you're so right. Like there are so many things that like you see on TV that you're like, oh, that would be cool, I'd love to do
Right.
that. Then you're actually in a situation like that, and
it changes. Yeah.
100%. Okay, like what do you like the most about being an emergency medicine
So I would think the most rewarding thing is truly helping the underserved community, for one thing. Another thing is I always like to tell my students, or those who are shadowing me or I'm training, we are seeing people on the worst day of their life. We really are. For most people, they're coming in really, really, nervous. Most people don't have any medical knowledge. They have nowhere to turn to. Especially within the last year, like I said, they can't get appointments for months and months and months. And people are coming in desperate, and we are the one that they are actually, providing us with trust. So I would just say having that blessing of being able to help people every day, I have to constantly remind myself. That's why we went into this profession, right? Everyone goes into the medical field hoping to help others. So it's very rewarding. As far as medically, I would say I have learned so much in my last 11 years practicing medicine. I'm constantly challenged, constantly learning. And for that, I'm forever grateful. There's never, like I said, a dull moment where we're not seeing something new. And so I feel like those who think they have seen it all really haven't. So as far as emergency medicine, you're continually learning. So, yeah.
That's awesome. And then just wrapping things up, what is your life work balance like? Because you're so like into being the best PA you can be. I know that from experience, and even hearing you right now, like so great. But how do you handle that?
So I think as I just realized, there are those who can do it all, say it all, or watch it all. And I feel like a lot of PAs and a lot of us, we just are go-getters. We have the ability to kind of work life, balance life. So I think that I go to work. After work, I'm ready to, invest my time in friends and family, hobbies, all of that kind of stuff, traveling, dance, everything I can to the best of my ability. So when I'm off, I literally totally give my life to, my social life. And then when I'm at work, so it's a constant battle. I think I've done a good job of it now that I've just been doing it for 11 years. Also, as a PA, we're very, very lucky that, again, we can work any subspecialty. So I have the ability to, I'm an adjunct professor at a couple schools. I also work part-time at an aesthetic practice, Oceanside Aesthetics, when I'm free and I'm not working shift work. So I think it's more of just being very organized, balanced, and then just going with it.
Yeah, because that was definitely something that I wanted in a career, but it was something I struggled those first few years.
Yeah.
So
it's hard. I mean, it's not easy. Having the lifestyle where every day is different is not easy.
Yeah.
But it's something that for now it works. And, you just have to be really organized.
Yeah, definitely. Like it's certainly it's great for lifestyle balance in some ways, but it can also throw you off if you
For sure.
if you can't get used to that constantly ever changing schedule.
For sure.
Okay, cool. All right. Well, I think this is pretty much all of like the big questions that I wanted to ask
Awesome.
you. So yeah, if there are any questions, is there anywhere that
if anyone has questions or want to reach out, reach out anytime.
Okay.
OPAs. That's all I have to say.
All right.
We're number one profession for a reason. I'm so proud of our profession.
Yeah.
Students that become friends and lifelong friends forever.
I know, me too. That's like one of the best things about this profession are like the friends that I've made in it.
Yeah.
So thank you so much, Diana. This was so fun. I love talking to you and I love hearing about your experiences, and it never gets old to hear about like just how amazing it is to be a PA and to hear things about being a PA from your perspective. So thank you so much. And I will send an email in case anybody has questions.
Sounds good. Bye, everyone.